Without further ado, I'll turn it over to Wausau Mayor Katie Rosenberg.
Thank you. Good morning, Wausau. Thank you for joining us. Our press conference today is scheduled for 1 hour. We have several experts on hand to answer media questions once I'm done making my remarks. In January, Wausau Water Works worked with the Wisconsin Department of Natural Resources and the Department of Health Services to voluntarily test every city well for PFAS. All 6 wells contained levels of PFAS that exceed the proposed DNR drinking water standard. The levels of PFAS range from 23 parts per trillion to 48 parts per trillion, depending on the well. Citizens do not need to panic. Wausau Water Works is not in violation of any drinking water standards or regulations, but we are taking actions to proactively inform and protect the health of our customers. I'm going to answer a few questions before turning it over to our experts. You might be asking yourself, what are PFAS? Per and polyfluoroalkyl substances or PFAS, I'm going to continue calling them PFAS, are considered emerging contaminants. According to the Environmental Protection Agency, PFAS are a group of manufactured chemicals that have been used in industry and consumer products since the 1940s. There are thousands of different PFAS, and they are found in nonstick cookware, water-repellent clothing, stain-resistant fabrics and carpets, some cosmetics, some firefighting foams, and products that resist grease, water, and oil. Now, according to the DHS, over half of our contact with PFAS comes from food, including eating food that was packaged in material that contains PFAS, eating fish caught from water contaminated by PFAS, drinking contaminated water, or accidentally swallowing contaminated soil or dust. So why are we concerned about PFAS? PFAS break down very slowly and can build up over time in people, animals, and the environment. The EPA, the Wisconsin DNR, the Centers for Disease Control, and the Wisconsin Department of Health Services, and the current body of scientific research are aligned and indicate that high levels of PFAS exposure are hazardous to human health. However, research is still ongoing to determine the level at which exposure to different PFAS would lead to adverse health effects. We have Dr. Sarah Yang from the Department of Health Services on this call to answer specific questions you may have about the health effects of PFAS. Now, you might be asking yourself, what are the PFAS regulations here? There are technically no regulatory standards from state or federal authorities. However, the science is still emerging, and PFAS are considered a hazard. Both the DNR and the EPA have issued health advisories about PFAS that are found in the water supply. The EPA currently advises remediation if 70 parts per trillion are found, and the DNR currently advises remediation if 20 parts per trillion are found. Both state and federal governments are working on regulatory standards, but the reality is that it could end up being anywhere between 70 parts per trillion, 20 parts per trillion, or even lower based on the continued research. The federal government appears poised to have a recommendation by October 2022, and the DNR board will discuss their suggested regulatory standard at their meeting later this month. We do have Kyle Burton from the Department of Natural Resources on this call to answer specific questions you may have about the PFAS regulatory standard landscape. So you might wonder, what has the city and the utility already done to address PFAS? Now, the first thing we've done is the city has been discussing PFAS in the utility and economic development meetings since the DNR, DHS, and EPA issued health advisories. When the DNR and DHS made their health advisories, the Wausau Fire Department immediately ceased buying and using firefighting foam that contained PFAS, switching to a more expensive but PFAS-free foam. Second thing we've done is Wausau Water Works voluntarily tested in this year, 2022, and there is a test from 2019 as well. Those results can be found on our website. And number 3, Wausau Water Works is working with the current drinking water treatment facility design team to plan and implement a pilot study for the removal of PFAS. The engineering team will prepare 2 to 3 PFAS removal processes and run them in parallel at the existing treatment facility. In the shorter term, over the next 7 or so months until the new plant is online, we need to decide how to move forward. I'm calling on the Wausau Water Works Commission to lead and the Wausau City Council to consider a menu of options that will help citizens cut down on their exposure to PFAS. Department of Public Works and Utility Director Eric Lindman is also on this call to outline some of the options that these policy bodies can consider. Each option requires policy body action and budget authorization. I'm also currently in contact with state and federal officials about potential funding sources, in addition to other solutions. The federal government authorized $10 billion in the infrastructure bill for PFAS remediation, but Congress still needs to act on some of the criteria. In the short term, the Wausau City Council and Wausau Water Works are likely looking at funding from the utility and/or city resources. My goal is to provide city residents with drinking water below the DNR's advisory of 20 parts per trillion as quickly as possible. It is critical that we act quickly to ensure we're meeting the public's expectation for health and safety, even though there is no federal or state regulatory standard. I'm now going to toss it over to Eric Lindman to address the potential solutions we've discussed.
Good morning. My name is Eric Lindman. I'm the Director of Public Works and Utilities for the city, for those who don't know me. Some of the immediate actions that the utility is taking on right now is the planning and preparation of a launch for a pilot study to determine the level of PFAS the new treatment facility will remove. The utility will be running a few different studies on different types of media for PFAS compound removal during the pilot study. Since there are currently no standards or limits and the city is below the published EPA Health Advisory level, the scope of the pilot study is really to test different media types to reduce PFAS to the lowest possible level. We anticipate the pilot study to be up and running early to mid-March. In addition, the utility, should the need arise in the future, is looking at several scenarios for the provision of alternative water sources. These planning scenarios will be shared with the Commission and Council for discussion, and staff is currently looking at feasibility of these different types of scenarios, as well as the cost of the implementation of the alternative should the need arise. The scenarios range anything from setting up bottled water filling stations at key points in the city to bringing in a large mobile treatment facility to treat all of the water coming out of the current treatment facility that is distributing water to the city. So we will have more details on those scenarios, as well as feasibility and cost and implementation before the governing body in the near future.
Thank you, Eric. Now, the DNR and DHS are recommending that residents reduce exposure to PFAS through drinking water and cooking certain foods. Next up, I'd like to introduce Dr. Sarah Yang. She's a toxicologist for the Wisconsin Department of Health Services to explain a little bit more.
Yes, good morning. I'm Dr. Sarah Yang with the Department of Health Services. So studies among people have shown that exposure to high levels of certain PFAS may increase the risk of certain health effects. The most common health effects seen in these studies include increased cholesterol levels, decreased antibody response to certain vaccines, and reduced fertility in women. These studies have also shown that PFAS can stay in the body a long time, some for many years. At this time, DNR has proposed drinking water standards for several PFAS. These proposed standards are based on recommendations from DHS. And to establish these recommendations, we conduct an extensive review of the available scientific information. For PFAS, the proposed standards reflect the latest scientific understanding of the risks and are set to protect all populations. When the levels of PFAS in drinking water are above recommended standard, DHS and DNR recommend that people take action to reduce their exposure. At this time, the levels of some PFAS in Wausau's water are above the recommended standards. Studies have shown that when people take action to reduce their exposure to PFAS, levels in their bodies go down. Wausau residents can reduce their PFAS exposure by limiting consumption of the water. This means reducing the use of water for drinking, preparing beverages, and foods that take up a lot of water, like rice, jello, and oatmeal. It is still okay to use the water for bathing, washing dishes, doing laundry, and other household chores. It is also okay to use the water to rinse foods or prepare foods that don't take up a lot of water, like pasta, potatoes, steamed vegetables. Other steps that people can take to reduce their PFAS exposure include following fish consumption advisories and vacuuming regularly to reduce any exposure from products within your home.
Thank you, Dr. Yang. Now I'd like to introduce Kyle Burton from the Wisconsin DNR, who will discuss the state's current regulatory standards related to PFAS.
Thank you, Mayor. The DNR is currently in the process of creating rules to establish standards for PFAS in drinking water, groundwater, and surface water. As the Mayor said earlier, on February 23rd, our Natural Resources Board will consider these rules, and their approval is the next step in advancing them to the legislature. Anyone interested in registering to speak or submit comments to our Natural Resources Board can do that on the DNR's website by February 17th. Thank you.
Thank you very much. So when this press conference is over, and actually I already requested it, I'm calling on the Wausau Water Works Commission and the Wausau City Council to hold special meetings to discuss PFAS. If you're a member of the public and you have questions about PFAS in the drinking water, the Marathon County United Way is ready to begin answering community questions on their 211 line. Now we're allowing time for media questions. Marathon County Communications Specialist Sarah Dowadat will be moderating. Reporters may raise their hand using the emoji button at the bottom of your screen, and she will also be moderating the chat for any questions.
We will start with Emily Davies.
Hello. So my question is just a basic one to start out. When you talk about doing an investigation into the drinking water, what does that all entail? What is all going to be looked at?
Are you asking about the pilot studies, or are you asking about maybe the DNR regulatory kind of investigation?
The pilot studies.
Okay, I'm going to allow Eric Lindman, our director of the utility, to answer that question.
Sure. What we're looking at is trying to find the appropriate media that will reduce PFAS to the lowest possible level. And so the new drinking water treatment facility, which is proposed to go online later this year, has an anion exchange process in it with a resin media currently. We know it has shown PFAS removal. We just don't know with our water chemistry how much removal we would get. And so we're going to set up the pilot study with that resin, as well as a couple other alternatives to determine which one works best with our water type.
Thank you, Eric. Our next question will be from Laura Schultz.
Hi, thank you so much for having this today. I have a couple of questions. Other cities around the state have shut down their wells that have been impacted. In other cities like Eau Claire have looked at digging new wells. Is that something that Wausau may consider to get away from the groundwater that contains PFAS? And then second, I'm wondering if any responsible parties have been identified at this point.
Thank you for your question. Wausau's situation is a little bit more complicated than some of these other municipalities, since every level or every well that we have has tested positive for the elevated PFAS levels. So shutting down the wells right now isn't realistic. But I don't know if Eric, if you have anything to add to that about digging new wells, that could be an option, but I'm not really sure what you're thinking.
We have had discussions with some of our design team about that. There'd have to be some groundwater investigations in certain areas of the city. So that's a potential long-term scenario that will be considered as well. Currently, right now, I think that our focus will be to determine what level of PFAS we can remove within the treatment facility.
And then when your question about the responsible party, right now, we've had these results for a little bit of time, and we're working with the DNR to establish if there is a responsible party. I don't know, Kyle, if you have anything to add to that.
Yeah, I think you're right on there, Mayor. The DNR is already conducting a cursory review of potential sources in the area, and if appropriate, we'll work with those entities, if found, to conduct a site investigation and remediation.
Thank you.
Thank you. Our next question will come from Mike.
Thank you. So do you, with these elevated levels that you've seen right now in every well, what's the best step that residents should be taking right now? Will a home filtration system or like a refrigerator water pitcher, is that enough to kind of get the levels down to a safe level for drinking?
Right, I'm going to allow Dr. Yang to answer that question. There is some evidence that the filter pitchers will work pretty well, but I'd rather have the medical expert answer that question. Thank you.
Yeah, so there are certain treatment devices that will remove PFAS. Not all filters or pitchers, will do that. So just a filter in your refrigerator might not be sufficient to remove the PFAS. We do have a brochure on our webpage. I think that will be linked from the city's webpage as well, that it describes the different ways the different systems that can remove PFAS.
Thank you.
Just a note as we continue on with our questions, if you've previously asked a question and that has been satisfied, if you could lower your hand, that would be great, unless you have another question and would like to be added to the queue. Our next question will come from Natalie Sapila.
Hi guys, thanks for having this. My question is for Dr. Yang specifically. I'm just wondering, in terms of residents who may be concerned about levels of exposures to PFAS in drinking water, I mean, what is the, I guess, time frame that you consider being exposed to levels of PFAS in drinking water where residents should be immediately concerned for their health, I guess? I mean, in other words, how much of this water can people drink where they should be immediately concerned, or is it something that, we should be taking steps to eliminate consumption right now as much as possible?
Yeah, that's a great question. So as I mentioned earlier, PFAS builds up in the body over time. So while it can take time to reach levels that can be of health concern, we know that when people do take steps to reduce their exposure, those levels in our body come down. So at this point in time, we don't know how much PFAS, is in our bodies, or at which level for each particular person a health concern could arise. So that's, again, why we're recommending that people take those actions to reduce exposure. Again, any action some people take is going to reduce exposure. So if it's, switching the drinking water source or making food a different way, for now, while the city is working on long-term solutions, that's going to reduce exposure.
Next up, we have a question from the chat. And that question is, when did the Public Works Director or Department become aware of the potential DNR 20 parts per trillion standard for the total or sum of levels? With a follow-up question of when were these results received?
I'm going to let Mr. Lindman answer the question about when we were alerted. The results that we received, I was alerted to them on just want to make sure I have the date correct, the 28th of January. So.
Yeah, so I believe the latest results were the 25th of January, if I remember correctly. The results are on the city's website under the PFAS site for your reference as well. So, yeah, and what was the other part of the question?
I'll repeat the question. When did the Public Works Director or Department become aware of the potential DNR 20 parts per trillion standard for the total or sum of levels, and when were the results received?
Yeah, so the results in late January, I believe the DHS submitted their recommendation in June, July of 2019.
Thank you, Eric. Our next question will be from Rob Meyer at WPR.
Yes, thanks. Question perhaps for Dr. Yang. Do we know, are there people, demographic categories, young people, old people who are particularly at risk from PFAS exposure, or is it sort of the risk is the same across the board?
Yeah, thanks for that question. So what we know right now indicates that the disparities between risk in different populations is very slight, if any. So while our recommended standards are based on studies that were conducted in developing babies, these levels are protective of all populations, and so we recommend all people follow this advice.
Thank you, Dr. Yang. Emily Davies, I see your hand is raised. Did you have a follow-up question for our panel?
I do. I actually have a few. So if it's easier, I can just ask them all now, or I can do them one at a time. I guess whatever is easier for you guys.
One at a time would be great so we can direct them to the appropriate person.
Okay. So I guess I'll start with, do we plan on doing any epidemiological studies based off of the population, especially those who have lived here a little longer?
I don't know what the standard is. I guess maybe Dr. Yang could tell us what happens in other communities.
Yeah, so DHS does not have any studies planned for the state of Wisconsin at this time. Generally those studies are best conducted by a research university. The Agency for Toxic Substances and Disease Registry has historically had funding opportunities that DHS has applied for and has not met the qualifications to obtain that funding, but that is something that we are constantly aware of and involved in those conversations.
Okay, thank you. And then just a question for, I guess, Kyle. With the DNR, my understanding through the EPA as well as through Wisconsin State Toxicology to set standards is it involves a degree of uncertainty, and the level of uncertainty lowers the standard in terms of the amount of contaminant that can be allowed in the water to make it potable. So is that being factored in with, what is our degree of uncertainty with these, since this is we still are learning about the damage that it can cause?
Right. Through our standard setting process, we ask for and then receive recommendations from our Department of Health Services. And then we use those recommendations to begin the rulemaking process. So our recommendations for drinking water standards are based directly off the science and health-based information we receive from the Department of Health Services.
And then has there been on any of these sites, and I'm sure you're going to be looking into them as part of your investigation locally, but have any of these sites had any treated wastewater spread over them or nearby? I know that WXPR had a report 2 years ago talking about Rhinelander's situation, and in those contaminated wells, they did have properly spread wastewater around those areas, and that possibly has caused the PFAS contamination.
Biosolids or wastewater can be a source of PFAS. In the Wausau situation, we're still working through that cursory review. We're not quite sure, though, that the wells are in a very urban setting here for Wausau. That may not be the case in Wausau.
And do we anticipate any compensation programs potentially for communities that have been identified as having PFAS contamination, especially since we don't have a standard at this point for people to avoid drinking the water if necessary?
Yeah, that is a great question, Emily. Thank you very much. The federal infrastructure bill that was recently signed will supply or will provide funding for impacted communities, specifically for those communities impacted by PFAS. That money will be funneled to states and available to impacted communities through our state revolving loan fund program. And we're waiting for specific guidance from the EPA on how we can distribute that money, but that is something we are certainly going to market and communicate with impacted communities and all communities when we have more information on how we'll be able to use that money.
And one final question for me, and I think this might go towards the mayor. I know that Congress is working out some more transparency from businesses who utilize PFAS in their production, but have any local businesses reached out to you or the city just stating that they use PFAS or just anything around those lines?
I haven't had contact yet with businesses saying that, although it is possible that before I came here, there has been some discussion about that. But I do probably anticipate some businesses reaching out at some point. Thank you.
Our next question will come from Laura Schultz.
Hi, I do have a couple of questions as well. Starting out, I'm wondering what compounds were found within the wells. Was it largely PFOA and PFOS, or were other compounds identified as well?
I'm going to rely on either the DNR or our utility director to discuss those results.
Yeah, it was primarily PFOA and PFOS, Laura, were the majority of compounds that were the highest levels.
Okay, and then I'm also wondering, other cities in Wisconsin are either looking at or have already filed lawsuits against the manufacturers of PFAS, and I'm wondering if that's something that Wausau is also examining doing.
I know that several of those law firms have reached out to our city attorney. That would be a policy decision that the policy body would have to decide on, but that's not out of the question.
And one final one for you guys. Of course, standards are in the works specifically for PFOA and PFOS. And if the NRB passes those, they'll be going to the legislature. If those are enacted this year, how could that change Wausau's response?
I don't know if it would change it. I know my goal is to get us underneath that 20 parts per trillion health advisory that the DNR has given us. So I don't know that it changes our response, other than we will continue to work quickly to get under that 20 parts per trillion, or whatever the standard is.
Thank you. We do have a comment in the chat from Shireen, and that reads, I'm seeing test results from 2019 that show levels that are also above the 20 parts per trillion level. Eric, can you speak to that at all?
Yeah, during our design process for the new treatment facility, we did test the raw water in the wells to help us determine the emerging contaminants on, is this something that we potentially would have to address at that time. So that is one of the motivations that we move towards the anion exchange process in the new treatment facility.
Thank you. Our next question will be from Tom Killian.
Thank you. I just have two questions. One would be if there was an awareness from the city of the potential DNR standard of 20 parts per trillion with the total levels, and some of these results were quite dated, then why wasn't the public notified at an earlier date if that standard was known and those test results were from as far back as 2019? And then the second question would be if this information we're dealing with today in general had been known for multiple weeks, then why was it that it was withheld from city council members until essentially this morning? Thank you.
I can answer the second question first. I will say that it's taken a lot of effort to coordinate our both understanding of PFAS and the results. So we've been working with the DNR, the DHS. I've been contacting folks in our senator's office and our governor's office to ensure I understand what's going on and what our available resources are for remediation. So that is it. I've had these results for about a week and a half. So We are given 30 days by the DNR to notify the public, and we wanted to make sure we gave this information as quickly as possible as we had it. I can't talk to the test results in 2019. I'm not exactly sure how that went with the previous administration, but maybe Eric has some more information about that one.
Yeah, so the test results that we had in 2019 were taken. It was after that the recommendation of the 20 from DHS to the DNR was proposed. So typically, with no standards in place, we take direction from the DNR, and it was just in late December that the DNR approached us to ask us if we'd be willing to test for PFAS in the community wells. And a lot of that, I think, had to do with some of the other municipalities within the state, their detection levels. So right now it's voluntary, and I know some municipalities have chosen not to do it, and I know many are in the process of doing it.
Thank you.
Yeah, and Kyle Burton with the DNR, I can just follow up a little bit on what Eric just said. We did reach out to Wausau in December of this year and ask if there had been any historic sampling for PFAS in Wausau. So December of 2021 was when we first found out about the results. In 2019, we talked those through with Wausau, recommended some confirmation sampling to get some better data. And then when that confirmation sampling came back in January of 2022, that's when we started working through this process of public notification.
Thank you, Kyle. Next up is Rob Meyer from WPR.
Thanks. Question for Mayor Rosenberg. The city's statement says that people do not need to, immediately stop drinking the water. You have said that don't need to panic, but it is destabilizing to think that something as essential as the water that we drink may be unsafe or may, in aggregate, associated with these bad health effects. Can you speak to people in Wausau about, who would have feelings about this? Like how should people think about this as a health risk?
Right. I'll answer some of this, and then I might also flip it over to Dr. Yang. Now, I guess one of the things about PFAS is that it's the cumulative effect of buildup in your body over time. So it's a little bit different than maybe contaminations where you might hear about boil orders or things like that. So it's about buildup over time. We don't want that buildup to happen. So that's why we're talking to folks today about reducing that intake of drinking water that might contain PFAS, or foods that contain high levels of the drinking water. So I guess I want to encourage folks to take this information and decide for themselves how they are going to react. I will tell you that we're going to work as quickly as we can to make sure that our entire system is set up so folks can feel confident that we're below that 20 parts per trillion. That will take a little bit of time, but it is accumulation in the body over time. I don't know, Dr. Yang, if you have anything to add.
I guess I would add, that we understand that this can be a scary thing and something that people might not know very much about. So I think, the city is putting together a great webpage with resources. It links to DNR and DHS resources. There are plenty of folks happy to help walk through concerns and issues that people have. That being said, the levels in the drinking water are higher than we want to see. We don't know that means that people are getting sick from this water. If you have concerns about your personal health, please reach out to your medical provider and talk with them about those. The things that we're talking about that can be health concerns for PFAS can also be health concerns for many other reasons. So if you have any of those health concerns, it is best to work with your medical provider.
Thank you.
Next question from Emily Davies.
Yeah, just a follow-up again to the 2019 results. And we've done tons of coverage on Rhinelander when they found out in 2019 and have shared the the dangers and health risks and the mitigations that they've had. And I understand that they only have a handful of wells versus all the wells. But I guess if we found out that there was PFAS in 2019, and given that there has been emerging information regarding the safety of it, why wasn't, I know it was voluntary, but why wasn't that looked into given the concern elsewhere?
I guess I'll let Mr. Lindman know. He was working for City Hall at that time.
Yeah, I think Emily, it depends on the levels. The levels that we're finding were below the EPA Health Advisory, and that was the number at the time that we based and looked at. And that's really the published number at this point in time. And there are currently just recommendations at this point for a lower number. And so back in 2019, I think the wells that you're referring to were above the EPA Health Advisory level.
We have another question in the chat asking, what kinds of health concerns and specifically what are we looking for?
I might let Dr. Yang answer that question. Thank you.
Yeah. So again, there have been a number of studies that have looked at health effects of PFAS, and again, we're talking about a class of compounds that can have more than 5,000 different substances. So it's hard to say all of the substances can cause, this list of health effects. From the studies that we've seen among people, the most common health effects are increased cholesterol levels, decreased response to certain vaccines, and decreased fertility in women. There are also studies among research animals that have seen other effects, specifically effects on development and reproduction. And those are the studies that we've used to base the recommended standards on to ensure that we're protecting the public from these types of things.
Thank you, Dr. Yang. Our next question will be from Laura Schultz.
Yeah, Katie, you mentioned that you're going to be encouraging the city council to, to meet and take up, some of these solutions. Is that going to be immediately, like this week, or in the coming month or so?
I would like it as immediately as possible. I have already asked the Wausau Water Works Commission to start coming up with a date where we can have a quorum so we can talk through this, give them the right information and also some of the solutions that we have discovered. And we do need action. I would prefer it as quickly as possible. So I'm hoping this week or next week. Did you have a second question?
Nope, that was it. Thank you.
We have a question in the chat for Kyle Burton from the DNR. When specifically did the DNR communicate to municipalities the 20 parts per trillion recommendation?
Can you repeat that? I think I missed just the first part of it. I'm sorry.
Sure. When specifically did the DNR communicate to municipalities the 20 parts per trillion recommendation?
Okay, thank you. We began the rulemaking process in the fall of 2019. Our first public hearing on the 20 parts per trillion recommendation was in November of 2019.
Thank you. Emily Davies?
This question is also for Kyle. So I know that the governor has those grant opportunities for municipalities to test. Are there any other supports that will be coming to help? Because this is going to be an expensive adventure for municipalities that find out that they have PFAS in their water. So what kind of incentives, other than out of the goodness of people's hearts to be able to keep their citizens safe, in terms of expense, it would seem that ignorance might be a way to say, well, we don't know about the problem, so why should we go and find out if we are going to have to pay for those costs? So I guess I don't know if you can speak to that at all, incentives that way.
Absolutely, and thank you again for the question. The federal infrastructure money that I was talking about earlier, there is a significant amount of money coming straight to Wisconsin for addressing problems just like this. So impacted communities will be able to apply for loan or grant money to implement long-term solutions. So, and this money is coming on a limited time basis. We kind of have a window here of the next 5 years where we'll have money available to communities specifically for mitigation of PFAS. So now is the time to understand if we're impacted or communities are impacted by PFAS and begin to work with the department to apply, become eligible for that funding, and work through solutions on those PFAS impacts. And another reason communities would want to sample for PFAS now, would want to take advantage of the governor's voluntary PFAS sampling for all municipal systems that he announced yesterday is just for this reason. We want to assess and understand people that are or communities that are impacted. So we can start these mitigation efforts, so we can give people the information they need to know to protect public health.
Thank you, Kyle. Emily Davies?
Just kind of a quick follow-up, kind of related to that. So this is probably another question for Kyle. I've read some reports about Congress, and again, this is kind of outside of the state purview, but I'm sure it'll be brought up here as we go along. There is a company in Michigan, for example, that has concerns about some of the PFAS regulations that might be coming in and preventing them from being able to, in this specific case, it was looking at, they manufacture car chips, and then that will delay the process of us being able to have enough chips to get our cars made and delay some of the process of business that we have here. So I guess, what is the importance, and I guess how will that be handled when it comes to managing what businesses need and want, but then also, of course, the maybe not even going beyond potable water, but going to fresh water, clean water for people to be able to drink and use?
That's another great question, and there are always those economic characteristics or situations that we want to be mindful of when we create standards. Drinking water standards specifically are created with the public health in mind. First and foremost, we want to protect people from situations where they may be at risk through drinking water. So that's our first and foremost. That's why we want to promulgate these standards and be able to communicate risk and helps impacted communities mitigate those impacts and get back to serving water that's below those recommended levels.
Thank you, Kyle. Next question from Laura Schultz.
Hi, my question is for Kyle. So of course, Governor Evers announced last night the $600,000 for testing, and I'm wondering, how far that money will stretch in terms of testing. Will that enable, every municipality in the state to have access to testing, or will it be just a selection of communities that apply for the money?
Well, first, thanks for bringing it up. We are now communicating directly, or will be communicating directly with all municipalities across the state of Wisconsin and offering funding for voluntary testing for PFAS. We expect that the money available will be enough to sample all interested municipalities. And if we are in a situation where we don't have enough funds for interested municipalities, it'll be very important for us to continue to make that voluntary sampling funding available. So the expectation is that what we have will be enough for the initial sampling, and if it's not, it'll be a priority for us to extend the funding availability.
Thank you.
Thank you, Kyle. I don't see any additional questions in the chat. Do we have any additional questions from the media on today's call? Last call for questions. Seeing none, this will conclude today's press conference. We want to remind you of a couple of additional resources that are available where additional information will be posted as the situation progresses. The first being the City of Wausau's website, where there is now a PFAS information webpage available with additional information. Additionally, residents and businesses with questions may also contact 211, which is a service provided by the United Way, and they are ready and able to provide you with additional information. Thank you for joining us.